I will retort on my computer, I guess.
Good.
And I think what I will do is mute everybody first.
Okay, you're doing it.
I am. And then I will turn this over to Sharon, and I will make you the host. And don't forget to unmute yourself.
All right, I am seeking to share my screen. Let's see. Oops. Okay, can you all see my title slide?
I can see it fine.
Okay, great. I see a lot of heads bobbing, so thank you very much. Patricia and I are very happy to be here with you this afternoon, and thank you for the invitation, and thank you, Margaret, for reaching out to invite the health department to update you all on COVID-19 in Fairfax County, and I'll touch a little bit on Virginia and what we are doing as a public health department to ensure our community stays safe and healthy during this pandemic. So as Michael mentioned, my name is Sharon Arndt, and I am the Director of Community Health Development at the Health Department. And during this pandemic, I have an activated role as Liaison Officer for Community and Nonprofits and the High Risk Task Force. So much of the information I'm going to share with you today can be found on the county's website. And Fairfax County has a very robust web presence related to COVID-19. And the address you can see there at the bottom is fairfaxcounty.gov/COVID-19. So I would encourage you, if you'd like to learn more about coronavirus 19 in the county, to visit this website. And there are many, many resources on that site. So one of the resources that the health department directly manages, oh, I have to admit someone, hold on a sec. Okay. One of the resources that the health department manages is our case data dashboard.
In regards to our staff, this has been a very trying year for many of our staff members.
Oh, Michael, can I mute?
You should have full control. If you want, I can go back and take over. And
okay. Oh wait, I see it's up above. Participants. Sorry, folks. One moment. I'll just mute. Okay, I think I have everyone muted. All right.
Sharon, this is Patricia. Your slides are showing up where you have the main slide, but then the next slide shows up. Could you do it where we're only seeing the current slide?
Oh.
Just might help.
Okay, hold on. Thank you, Patricia.
Sure.
I'm not seeing the, here, hide presenter view. Is that better, Patricia, where you can just see the main slide?
Well, you might want to hit slideshow now because we still see all of them on the left side, but
okay.
This is better than before if you can't do that.
Okay. Wait a minute, down here.
At the top, I think where it says slideshow, right below the orange ribbon at the top and go on over slideshow, that might do it. Oh, that didn't. Oh, well, this is better than before.
Okay, hold on. There must be a way. I'm sorry, folks.
Was going to get there still hot because I dropped it off at the gatehouse. But within like 12 minutes, she had the pizza.
Okay.
So those are examples of the
Michael, if you want to monitor the muting of folks, if everyone could please mute.
Tonight, and I do say, please, if you can, this is the time to acknowledge it.
yeah, well,
And
So some upcoming events, some fun here on campus, as I would like to say. So we are doing a department Halloween door decorating contest. We're also doing a department pumpkin carving and decorating contest. And we would encourage our residents to decorate their
great.
Not quite sure what that was, but should I go ahead and make you, I'll tell you what, I will make you a co-host. I think that's a better.
Okay.
I think I can.
Okay. All right, let me get started. I'm Patricia, how is the view?
There's a control under slideshow that says fit to window. Just went away.
Yeah, I wish I could help you. I use a Mac. This is not a familiar screen to me.
Yes, and I use.
We can see it, Sharon.
Okay.
It's a slideshow that is on top, the underline. No, over, up.
I think if you go all the way to the top, up there in the orange bar, right next to the hand, there's a screen picture. Way up.
Button.
Yeah, it's not projecting.
Hit the slideshow.
The next one over. There you go.
Now hit that.
Yeah.
Sharon, up on the orange ribbon, if you go all the way to the left, and then you can start moving it right there. See that little hand right to the left of the hand? Click on that one. The next one. No, back over a little.
This one?
No, see, it looks like a little screen. One
This
left of that one.
That one.
That one. Does that do it? I don't know if you clicked on it.
I did.
Oh.
All right, folks. I'm so sorry.
All right. This is fine though. We can see it.
It's.
I think it's better just to go ahead now. It's large enough I can read it, so anybody
Okay.
should.
All right. Let's get going here. I apologize. I've done this many times, and I don't know why it's misbehaving today. So. And now can you all see this?
Yes, we can see it.
Okay. All right. So everything is on the county site. And the other thing that the county has is our case data dashboard, which we look at by zip code. And I think what it's really important to note here is that community transmission continues to occur across Fairfax County. Even though some areas might look darker than others, there is COVID-19 disease in every area of Fairfax County. The numbers I have here on the slide show the number of cases in Fairfax since early March. We are over 22,000 cases in Fairfax, in the Fairfax Health District, which is Fairfax City, Fairfax County, and the City of Falls Church. Across Virginia since March, we have 160,000 cases, and across the country, we have almost 7.8 million cases across the country. Now, when we look at the data, at the top chart here is Virginia, and this is data from the Virginia Department of Health. This is the number of daily cases since early April on the far left to the present day, actually yesterday on the far right. And you can see, if you all recall, back in the spring, we were on phase 1 of our restrictions for activity. And then we slowly opened up at the end of May, and we opened up even further at the beginning of July. Remember that transition from phase 1 to phase 2 to phase 3. So at the end of May, we opened up to phase 2. And you can see there at the end of May that there was an increase in cases in the state as well as in Fairfax County. But then as we opened up in July, the state cases did rise quite a bit, and you might recall there was quite a bit of community spread in the Hampton Roads, Virginia area and in the Richmond area. But in Northern Virginia, remember, we stayed in our phase 2 longer than other areas of the state. We in Northern Virginia have really been advancing these protective behaviors we all must employ to keep the disease at a minimal level. And we have been very successful. In Northern Virginia and specifically in Fairfax, we haven't seen the increase in cases as other areas of the state. Now here's another chart that looks at the trajectory of cases. It's the number of cases over confirmed cases over total number of cases and time. And you can see that since early August, since early August, we have declined, and we are still at an elevated level compared to where we were when we started, but we are really holding steady with our disease rate, which is very encouraging. Also in the state, the Virginia Department of Health does have a couple of status dashboards, and the current status for Northern Virginia, which is this light gray area right here, the Northern Virginia Health Districts, and that is Fairfax, Prince William, Loudoun, Arlington, and Alexandria. We have a low transmission rate right now, which is very encouraging. And again, it's because of our commitment to protective behaviors. Right now in the, this is the central portion of the state around Richmond, it is actually a high transmission rate. So, and then the little gray dots mean that we're fluctuating, but in Southwest Virginia, it is increasing, the rates are increasing. So next week we might see Southwest Virginia in a darker blue color. But anyhow, in Northern Virginia, we are doing well, which is encouraging. And again, this is Northern Virginia, the rate of transmission. So we are here in September and October at a lower rate of transmission. This is another one of the charts from Virginia Department of Health that shows we have a low burden of disease in the northern region and low community transmission. So all of this transmission rate and our low rate really is a direct result of us continuing to emphasize those behaviors and these public health actions the health department is doing to prevent the spread of COVID-19. So the preventive behaviors, which many of you have heard, are about wearing a face covering, the 6-foot physical distancing, staying home when sick, and I can't emphasize that enough. If you are not feeling well, please stay home. Washing your hands, not touching your face, disinfecting surfaces. The other actions are the public health actions where our team and our army of epidemiologists and contact tracers and contact investigators or case investigators are out there trying to detect cases, investigate and isolate those cases, and quarantine folks. So let me just share with you some of the work that we have been doing in Fairfax to emphasize protective behaviors to keep our rates low in Fairfax. And the first thing here is our website, which I did share with you early on. fairfaxcounty.gov/COVID brings you to the health department's website. The health department has a Facebook page. So if any of you have a Facebook account, I would encourage you to look up the Fairfax County Health Department, and we do post regularly on our Facebook page. In January, we had 2,800 followers, but today we have over 17,000 followers. So there's good news about this pandemic, as I think it is bringing folks awareness about public health and connecting more folks to the health department. And then for Twitter, our followers have also doubled since the pandemic started. we do have a toolkit of resources for our partners that we curate. And every week we highlight a different topic. And I know last week it was to get a flu vaccine. So we have this toolkit and we encourage our partners. As I mentioned earlier, I work with the community and nonprofit organizations. So we share this information out with all of our nonprofits and community partners so they can then share the information even further. The health department has produced a considerable amount of resources to help our community to navigate the pandemic. These are social media posts about face coverings, how to be safe at home, different graphics and flyers and materials and signs. All these resources are available on the health department site, but we have been sharing this work out with our community partners, and we share it out with residents too at different food distributions or other opportunities to engage on these topics. We've done a lot of video and digital advertising. I mean, that is really, gone are the days of pamphlets and brochures. Really, a lot of our communication work nowadays is on a video presence with YouTube and Facebook and clips. So we do still do brochures, but we are connecting with our residents through video and digital advertising. So here are some examples of different presentations that we've prepared, and these are all available on our health department website. And then we've also produced hundreds of different documents and resources and assets in different languages. As you all may know, Fairfax County is a very diverse community, and we have many residents whose primary language is not English, and we do need to make sure we connect with everyone so that we all collectively can help reduce the spread of disease in Fairfax. So we have this language portal, and we do have information assets available in Spanish, Vietnamese, Korean, Chinese, Arabic, Urdu, Farsi, American Sign Language, and some other languages. We do curate materials not just locally in Fairfax, but we do pull in from the Centers for Disease Control and Prevention as well. And this is an example of something we have done. We have noted there is a disproportionate rate of disease in our Hispanic Latino community in Fairfax. At one point, the rate of disease in the Hispanic community was 16 times the rate of disease in the non-Hispanic white community. So we've been working very hard, and that's actually some of my work related to the high-risk task force. We've been working very hard to connect and educate our Hispanic residents on prevention and where they can get support to navigate the disease successfully. Because of all of these efforts, we've actually reduced that disproportionate rate of disease down to 4 times. It's still too high, but it is now 4 times the rate of disease in our Hispanic non-white community as opposed to our white community. I mentioned the Toolbox earlier and the work we do with our nonprofit leaders and other community-based organizations. This is our toolkit. The website here, fairfaxcounty.gov/health/novel coronavirus/tools. That page has a weekly highlight and then some resources so folks can continue to spread the message and share the preventive behaviors, activities, and education that we need to throughout our community. And then finally, our media and public relations, I mean, this pandemic really has been a very communication heavy response. There's a lot of different messages out there. There are a lot of different stories, but we in Fairfax, we create our own content locally. We also draw a lot of our guidance from Virginia Department of Health and from the Centers for Disease Control and Prevention. And we do encourage residents to start with the health department. When you're looking for information about COVID, please start with the health department and avoid places that might not have credible information or could be misleading. So because this has been such a information response, information heavy response, here are some of the numbers that the Fairfax County Health Department has been managing and handling since mid-January. So we've had over 400 media requests. We receive over 3,000 emails related to COVID. We have a text line now. There are 1,700 subscribers to that text line. And for those of you who are savvy on your cell phones, if you text to the number 888-777, if you text FFX COVID, Fairfax COVID, you will be subscribed to our text line, and that has daily reports on our dashboard and other information about staying safe. And then we've been operating a call center since early March in the health department, and we've received over 22,000 calls. And I do have that number at the end of this presentation to share with you. If you have any questions about COVID, I encourage you to call that call center, and health department staff will be able to assist you. So that's some of the work we've been doing around preventive behaviors, but we've also been doing a lot of disease detection as public health professionals. And this is the same work we've been doing for years. We do this work if there's a tuberculosis case, if there's a measles case. We do this work all the time to prevent disease spreading in our community. Now, in the related to COVID, we are seeking to box in the disease. And in order to box in the disease, we encourage weekly testing or wide testing. We isolate those who we find to be positive. We identify those who have been in contact with a positive case, and we seek to quarantine and recommend quarantine for those. And that boxes the disease and keeps it from spreading across the community. So to box it in, as I mentioned, we've greatly expanded our testing options, and you'll see that in one of my upcoming slides. Early on, it was pretty hard to get a COVID test, and I'm talking about back in March and April. But we've been working closely with our doctor's offices, our clinics, urgent care centers, pharmacies to expand testing. So there are a lot more options for testing. The health department also has expanded its testing resources, and we have testing sites specifically for contacts of cases. We want those contacts to get tested right away so we can continue to box in. So we have health department sites for contacts of cases. We do home outreach. If there are folks who have mobility impairments or childcare concerns and they cannot leave their home, we've actually sent nurses and community health workers to the house to either receive the swab or observe the resident taking the swab themselves, and then we do the testing on that. And then we host community testing events in areas of the county where there are limited resources to providers. We have a lot more staff on board in order to handle this pandemic and our very large community of over 1.2 million residents. We have hired some contract staff, and there's over 300 contract staff on board and 70 community health workers who are folks going out into the community and working with our positive cases and folks in quarantine to make sure they successfully stay at home and they have the resources they need to stay at home, and again, to further prevent the spread. And then we've been working with different partners so that folks have a medical home and they can get the health care they might need from our safety net providers. And the county has always had emergency basic needs support, and we continue to connect residents to that emergency basic needs support, whether it's emergency support for food or prescriptions or housing assistance like rent or mortgage if they cannot work. So that's our coordinated services planning group, and they've been incredibly busy, not just with people sick, but as you're probably aware, there are so many people whose income has been greatly reduced during this pandemic, and the coordinated services planning is helping to support folks with emergency financial assistance. And then the last thing we've done to support successful isolation and quarantine is we've set up these shelters called Cupid hotels. Now, if you can imagine, if we were to have a hurricane in Fairfax, we would have set up a shelter. So folks whose homes may have been destroyed, if there's a large fire, folks who are displaced due to that emergency need to go to a shelter. So for this pandemic, we have a similar shelter, but we call it our Cupid shelter. And Cupid is quarantine, protection, isolation, and decompression. So some residents, for instance, those residents who are in homeless shelters really can't live, it's not safe for them if they have underlying health conditions to live in a congregate setting. So we have decompressed our homeless shelters and we've moved some folks into these Cupid hotels so that for this emergency, we have safe shelter for our residents. So this slide gets to the testing. As I mentioned, one of our public health actions is to greatly increase testing across the county. So in early April and May, we had many cases. The blue are the positive, well, the gray are all of the tests offered. The blue are the positive tests, and the black line is the rate of disease, the cases of disease in the county. So you can see now, here we are in May when there are a lot more positive cases but limited testing. You can see how testing has increased, and those who are tested, the positive cases have decreased. So our percent positivity right now is about 5% for all tests that are offered. And this is also something that is monitored by the Virginia Department of Health. This is a slide from the Virginia Department of Health's website, and that shows the percent positivity of tests. It is decreasing to 4.1%. So that is a good news because we have more tests and our disease is decreasing, but because we have more tests, our percent positivity is decreasing. So this is where this is a good place to be, and we are pleased we are having a low percent positivity in all of our tests. The other public health action, which I told you about, was the case investigation and the contact tracing and really boxing in the disease to keep people at home and to monitor folks who are positive within our community. So this chart here shows the number of folks who are enrolled in we have a web or a cell phone monitoring system, a wellness alert system. So we have 1,400 residents, and this is these bars are actually all daily numbers. We have 1,400 residents today who are being monitored, and we are in contact with them through the health department. And then yesterday or a couple days ago, we had 183 new folks enroll into the system. So as we progress over 14 days, some folks will drop off and some will join in. So we are actively monitoring and supporting residents across the county. And the reason why this is so important, this whole box it in with timely case detection, timely testing, timely contact tracing, is because we are really trying to slow that spread, and we've been very aggressive to slow the spread of the disease. And in the county and across the country, someone may start their illness, and here that's at day 0 when they start their illness, but they can infect others 48 hours before they start to show symptoms, and they can spread the infection up to 10 days after showing symptoms. And when we normally find a case, it might be at day 7. So by contacting folks who are positive, learning of their contacts, and making sure those contacts stay home, and making sure those who are positive stay home, we can greatly reduce the spread of disease in our community. So this is what we've been doing to try and reduce the time when individuals can spread infection throughout the community. This pandemic has required the health department to do a public health response, and we've activated a command structure, and just as say a fire department may have a command structure for a large fire or emergency. Public health has done the same. We've divided our county into 8 different areas, and those are called emergency support function areas. And we have been activated for 265 days. So we've been activated since mid-January when we were starting to track the disease in China. Our health department activated, and then it was mid-March or early March when Fairfax County and much of the state entered into that phase 1 pandemic response mode, where we all needed to stay at home and be safer at home. I mentioned the staff earlier, but in the health department, we have currently over 507 staff assigned to the response. There are 232 staff currently assigned. Over the summer, we used a lot of our school health aides who, obviously the schools were closed and it was summertime, so they supported us. But as we've been transitioning to expand our contact tracing workforce and our community health workers and school health folks going back to school, we have 341 contract positions, and those will be short-term positions that'll be with us for the next year. We've also relied on our volunteers. In the health department, our Medical Reserve Corps volunteers are the volunteers who support public health across the country. And in Fairfax, we've had 251 Medical Reserve Corps volunteers volunteer already over 4,600 hours to our public health response. So these volunteers help us with our community testing events, they help us with community outreach, they help us in our call center, they help us to stuff packets of information that we distribute to individuals at home. We call them care kits. So we do use our volunteers in many different ways, and we are so grateful for their time and talents. And then finally, as I've talked about all the great work we've done, it doesn't mean that what we need to do is continue to be vigilant. We continue to be vigilant. The rate of disease down in our community. This is a slide from Virginia Department of Health, and it shows that our daily case incident rate per 100,000 is currently at 10.5. So you can see it's just upticking. It's fluctuating, but it is going up a little bit recently. That is something to be concerned about. I think we've all had a lot of pandemic fatigue. This has been going on for many months since March. Many of us have been safer at home. And I know many of you as older adults are trying to stay safer at home. So it is increasing. With the holidays approaching and the seasonal flu season approaching, we must continue to remain vigilant and practice our protective behaviors. I would encourage all of you to seek a seasonal flu shot as soon as possible, but not later than the end of October. If you have any questions about seasonal flu shots, absolutely talk to your provider, but please make sure you get your seasonal flu shot. I can share with Michael later, the health department is offering seasonal flu vaccine clinics at our Adult Day Healthcare Center, so I'll send out those dates to you all. But as many of you know, you can obtain seasonal flu vaccines from local pharmacies and grocery stores and your providers. So please make sure you get your seasonal flu vaccine, as we want everyone to stay as healthy as possible as this pandemic and COVID-19, as we enter into the winter months with COVID-19 and seasonal flu mixing up together. So the key prevention messages as I close out my remarks is to always remember, if you have any symptoms, fever, cough, shortness of breath, muscle ache, sore throat, loss of taste or smell, a cold, oh, it's just allergies, whatever it might be, if you're not feeling well, please stay home and stay away from others. And also get a test if you are concerned you may have been exposed to COVID-19. When you're outside the home, always wear a face covering where you might be around others or within 6 feet of others, no matter how well you know them. Stay 6 feet away from others as much as possible. Please wash your hands frequently. Keep your hands away from your face. Use hand sanitizer. And if someone at home is ill, please try to stay separate from them as much as possible and practice those same behaviors within your house. So that is the conclusion of my remarks, and I will transition over to Patricia, but I just wanted to share with you here that our website again is fairfaxcounty.gov/COVID-19. Our information line, or that call center line I told you about, where we've received over 22,000 phone calls with all kinds of questions about COVID, that is 703-267-3511. We do have our email address if you're more comfortable sending an email at FFX, which stands for Fairfax, COVID@fairfaxcounty.gov. And then I have here our link, and you can search the Fairfax County site for our Medical Reserve Corps volunteers. If you would like to become a part of public health and support us in our response, and you have some extra time on your hands and you want to volunteer for the health department, this is our Medical Reserve Corps website, and we are always welcoming new volunteers to join us. And the thing about Fairfax volunteers is you can specifically request only to volunteer in Fairfax, or you can request that you could be activated across the state. So there are some options there for being a public health volunteer. So those are some of the information resources and things I want to highlight for you. But I'm very happy that Patricia has joined me today, because Patricia is our long-term care strategic manager, and she's on my team, and she really brings together all of the different partners who support older adults and individuals with disability. So Patricia, I'll advance your slides for you as you present this Neighbors Helping Neighbors.
You need to unmute, Patricia.
Yeah, I guess I do. I'm sorry. I showed myself, but forgot to put my voice on. Well, it's good to be with all of you, and thank you, Sharon. I think I presented to your group quite a few years ago on the concept of aging in place villages. I don't know if some of you remember, or if your group changes frequently. But these next couple slides, I'm going to talk about how we took that program, where we provide guidance to people in their neighborhoods to develop these aging in place neighbor helping neighbor programs, sometimes called aging in place villages. And since that's part of the ongoing work by a member on my team, we decided when COVID came along that maybe we could help get more of these started so that folks could look out for each other during COVID in maybe particular ways. So we called this the Neighbors Helping Neighbors, or end-to-end during COVID-19 program. So it's an easy way to start one of these in one's neighborhood. If you want to go to the next slide. So there's just 4 easy steps to organize one of these. And I'm sharing this with you just cursory. I'm going to just go over it. But if you would be interested in starting one of these in your neighborhood, or helping or passing it along to others who might be interested, let us know. So it's just very simple. You basically let neighbors know through a flyer or some kind of electronic message about the fact that you want to start a little program where people can help each other during COVID, mostly volunteering. And then you would set up some volunteer guidelines. You would then connect volunteers with neighbors in need, and then use an organized system to track the service. So the next slide goes into a little bit more detail, but what do we mean by that? And I have to put my reading glasses on to read this one. It's fine print. So when you're engaging others to help, you just really need maybe 2 to 3 to 5 people in a neighborhood who want to organize one of these. And the kinds of things we're talking about is maybe calling people in the neighborhood. And a lot of these are started by people who are retirees, that are healthy retirees, or maybe in their early years of retirement. And so what they'll do is set up services to check in with people, but especially during COVID, to go get groceries for people, to bring their mail in, to try to arrange for them to see their doctors, whether it's virtual or otherwise. So they're staying connected to healthcare, they're getting the food they need, and they're checked in, so maybe being checked in with, so perhaps they're not too isolated. They would probably be the primary kinds of help neighbors would provide to each other. But you want to kind of try to promote it around the neighborhood through a website or through flyers, so people know about it and people know how they can sign up to volunteer to be a friendly caller, or to volunteer to go to the grocery store for someone. And we're not talking about all old people doing this, be recruiting young people in the neighborhood too, because during COVID, we know the older population has been much more vulnerable to the virus or to getting sick if they get the virus. So there might be some younger folks in the neighborhood that'd be willing to take a grocery list for someone, go to the store for them and bring the food back. So once you let people know about it, then you want to, whoops, I'm still on that slide. Then you want to kind of set up a little tracking system to match the volunteers. And I guess that's pretty much it there. But what I want to say, you can go on to the next slide, is that we're here to help lend guidance to anybody who wants to start one of these. And guidance means we'll talk to you, we'll talk through every step, we can help put flyers together, we can help you canvass the neighborhood and that sort of thing. So this is one program that we launched during COVID to try to support older adults in neighborhoods by neighbors helping neighbors. So then this slide here, which is kind of small there, by the way, I don't know if you can read it, but we're going to send this out to you later. And I can't read it to go over it, so I'm going to bring my copy up that I have separate here. So this is a list of resources that we put together, particularly around supporting older adults during the COVID-19 or the pandemic. And there's links here, and there's also phone numbers. So for example, there's a special article on people at high risk, including older adults, how they should best protect themselves during COVID. We have a link for that. How and when to safely visit grandparents. We have to visit with one's grandparents and other older adults. We have a special information link about that. We have safe steps to stay safe if you're over age 60. So this is all information on the Fairfax County's website, but these are direct links to them. We also have some guidelines here for community-based organizations, how they can safely operate during COVID-19. And we launched a free shopping and pharmacy pickup program for older adults during the pandemic. And there's just one number that you call, and the number's on this list. And regardless of income, the idea here is so older people will be encouraged to stay at home, and maybe if they're not comfortable using apps or paying the fees associated, which sometimes can be up to $50 a delivery, we'll have a volunteer who's from the Fire and Rescue Volunteer Squad who is fully background checked, and many of them are retired firemen, retired police officers. They will come to the person's house, and they will take a grocery list and either cash or a check made out to the store. They'll actually go in the store and do the shopping for them, bring the items and the change back. And all of this is done very safely. They don't actually interact with the person other than a phone call. So the person will leave a little envelope at their door. Ready to leave at the door. When the volunteer drives up, they call them and say, I'm ready to come get the envelope, put it outside the door. Then they go and pick it up, take it to the store. And the same is true when they come back. They drop it off, the package is off at the door, and the change in the envelope, and then they wait on the curb there or outside the house, call them and tell them to come pick it up and watch them pick it up. So that's a new service that we started. And the top two numbers on that paper are just ongoing numbers that any older adult or an adult with disability can call, or a caregiver, or a neighbor or a friend who wants any information about caring for older adults. And then at the very bottom is some of the repeat information just summarized that Sharon went over about how to learn about and contact the health department regarding specific COVID-19 questions, how to get on that text, how to email, and how to just go on the website, and specifically on the COVID site. I'm gonna put my glasses on to read that. So I just wanted to share that information with you, just since you are older adults, and I am too, so I'm in that category. I'm not retired yet though. So you can know what the county's been doing specifically for older adults, and some of this information might be helpful for you. So if you have any questions about that, I'm happy to answer them.
Well, thank you both very much. I think now is the time we think about going in and having our question and answer session. want to remind everybody we have a hard time limit. I believe you said, Sharon, you have to be off before 2:30. Is that correct? So we have, let's say, 10 or 12 minutes that we can dedicate to that. And I would like to start out myself since, hey, I'm in charge. What I really like, one of the things that's bothered me looking at these statistics is I've wondered why the Hispanic community was hit so hard. And I assume it's also the older Hispanic community, because if you look at the statistics for people in the certain age brackets, it's definitely been very, very weighted to the over 55 crowd, I'd call it. So maybe you could, is it their job profile? Or are they just too poor to go to the doctor? Is there some genetic thing we haven't heard about? Do you know?
So thank you for that question, Michael. So as I mentioned, our Hispanic residents have had a rate of disease 16 times higher than non-Hispanic whites. And that was early on, and now it is down to 4 times the rate. And that was the reason why the high-risk task force was convened, to look at different communities where there was this high rate of disease. And again, we have mostly focused on our Hispanic community. There are some areas where we are focusing on our African American and African Black communities. But in the Hispanic community, what we have found for many of the residents is that, early on, back in April and May, when we were all safer at home and staying at home, when many of us could work from home, as I'm doing today, many of those residents were essential workers, and they needed to go into work to earn their hourly wages. So grocery store workers, restaurant workers, childcare workers, other industries and services where they couldn't stay at home, where some of our residents can't stay at home like others of us can. So that was one factor. We have found that many of our Hispanic residents live in multi-generational households. And not only are these households multi-generational, but they can be overcrowded. Unfortunately, with the high cost of housing in Fairfax, we do have multiple families living in some residences. So overcrowded households is a factor. And we've also really tried to get deeper in to why some folks, one of the things why some folks have not been successful with the disease. Some of it was a resource issue. I mean, early on, I actually started a campaign to donate face coverings, and we've been seeking to receive 65,000 face coverings so that we can provide face coverings to those who do not have that resource, so that everyone can implement the public health actions to reduce the spread of disease. We have recently, we're just about finishing up some in-depth interviews with 20 day laborers to find out more about what they know about the disease and what protective behaviors they can implement, what are their barriers to implementing those. So as a health department, we are really committed to understanding why some folks have a higher rate of disease than others. And we've actually conducted these in-depth interviews that we're currently analyzing our data now to continue to focus on the high rates of disease in the Hispanic community and what actions we need to take to reduce that. So it's a lot going on, and it's not genetic. It is about ability to implement protective behaviors. It is about how folks are living and, can they separate? And it's also related to underlying high-risk health conditions. And unfortunately, many of our Hispanic and other residents of color have diabetes and heart disease and other high-risk health conditions that put them at greater risk for COVID. So there's a lot going on. but we are continually trying to reduce disease in our Hispanic community.
Thank you very much. It's kind of what I had expected, but it's nice to hear from somebody who's actually in there and on the front line. So this is an opportunity, limited opportunity for folks to ask whatever questions they want. If don't forget that you're almost all muted if you want to ask a question, and if you do, wave your hand vigorously and we'll pick somebody. Oh, John, yeah, I see your hand moving. I'm sorry. And Jerry, I think I saw you.
Either Sharon or Patricia. I have a family member who has been out of state for 2 months and just returned. Is it recommended that they do self-quarantining when they come back to this area?
So, John, so your question is, you have a family member who's come back to your home after being away for 2 months, and should they self-quarantine? So in Virginia, we are not recommending self-quarantine. I know there's some states that when you enter the state, you need to quarantine. We don't have that in Virginia. But, if someone has been in an environment where they may have been at risk or they haven't been taking the protective behaviors, you could implement requirements within your own household. I know earlier in the summer when my son went out west to travel, I actually had him wear a face covering in the house for the first week, unless if he was upstairs. If he was in his room and working, he was okay. But when he was up in the family environment, I did have him wear a face cover. And when my father-in-law, who's 84, comes over for dinner, we sit at our dining room table, and he's further away from all of us. I mean, I'm going into work and I'm at the community testing events, but we are just being as careful as possible. So I would encourage you to, implement what you think is necessary to keep everyone in the household safe. And those protective behaviors really do help. But there's no requirement in Virginia for anyone from out of state to quarantine.
Thank you. Jerry, you want to ask your question? I think we're trying to get a couple in before she has to go.
Okay, yeah, I had two, but I'll go to the one that I think is most immediate for everybody. Any recommendations on how to handle Halloween candy?
Okay. So, well, the good news is that Fairfax County has not canceled Halloween. And I'll find the document that we have put out guidance that the Centers for Disease Control and Prevention and Chairman of the Board of Supervisors, Jeff McKay, has sent out guidance around Halloween. The guidance is to essentially put the candy out on a table and allow folks to pick up a piece of candy, to not do the traditional door-to-door ringing the doorbells, because you don't want all those, you want to keep your surfaces clean. You want to limit interaction as much as possible. I plan to be with my family at the end of our driveway with the table set up, and I'll have some candy spaced out that children can come one at a time and select what they would like to have, touch to take. But I will post that guidance there for you for Halloween. It's not canceled and it can be done safely. We all know we've all given up a lot of our family traditions and holiday traditions over these last 6 or 7 months. We continue to just enjoy all of our traditions, but as safe as possible. So I'll get that guidance for you, the Halloween guidance.
Okay, I think we probably have time for one more question. I really don't want to make you late. Does anybody else have anything pressing or specific to their particular issue? Okay, well, then I really want to thank our presenters, Sharon, and you guys and Patricia. You guys did a wonderful job, and we really appreciate that. And this will be hopefully posted on our website. And when we get any more information from you, if you're going to forward some stuff, then we'll send that out to as many people as we can, either as a separate communication, or we'll also, just send it out as part of our, hopefully part of our newsletter. I can get there. So I think that then if you guys have to go, be our guest and go. I think as far as the rest of the meeting goes, I think we're probably done here, unless other people have other comments for me or for in general about what's going on with NARFE that we know of. We know almost nothing. There's been a lot of discussion swirling around about having joint meetings with some other chapters because of the fact that some of them have not been as successful as having meetings online as we've been able to do. And so we're looking into that. I can't promise that that will happen or happen effectively. See you later. And but we'll continue to do it. So don't be surprised if the next time we have a notice come out for a meeting, it'll also include some other chapters, and or perhaps we'll be trying to schedule to listen in on somebody else's presentation if they've got an especially interesting member, since it's a lot easier to plonk into somebody else's meeting nowadays simply by knowing where the web is, so we can do that. So we'll be trying to stay in touch with other chapters and get some other stuff done. So I think with that, we have gone through our agenda. If there's nobody else, if no one else has any information or items they want to bring up, I'll accept a motion to adjourn. Somebody's going to have to.
I so motion.
And a second.
Second.
Okay, so this ends our 3,427,000, who knows how many meetings. And I thank you all for attending, and we will see you next month, if not sooner. Bye, guys.
Bye.
Thank you, Mike.